Hi folks, this is John Adamson, the Rehab and Documentation Guru. I am having a very interesting, complex patient day, and I like to share clinical stuff with clinicians, and I love to get input from people when I have interesting things going on with my patients, because I think it helps, this dialogue helps improve all of us in terms of our clinical expertise and our ability to meet the needs of our patient. So I have a patient who's young. He's younger than me, and he came to home health because of recent bout of diverticulitis with a functional decline in mobility. So he got PT in addition to nursing. And he came home and he started gaining weight, and he's gaining fluid, and he's got 3+ pitting edema in both legs. So anyway, we've sent him to the ER twice. Like the first day I saw him, this young guy, I did a 30-second chair rise on him. He had an abnormal cardiac response. His heart rate went way up. His blood pressure dropped just from standing up. He was posturally hypotensive. And today I went to see him, and he has increasing edema now in the abdominal area. Last time he was in the hospital for the ER, I should say, he weighed, well, I won't give a specific weight. That might be giving too particular details. But he had gained 22 pounds in a week and a half. And the doctor basically told him and his significant other that if he was having heart issues that they could detect, then they would keep him. But they sent him home despite gaining weight. And what the doctor told him was that home health can manage that. Well, no, we can't. We can certainly advise the doctor what's going on. The doctor can make orders like changing meds. Maybe we can come back to reassess if things are working out. But this guy has a clear emergent situation going on. He's gaining weight. And today when I saw him, not only was he getting increasing abdominal distension and pain, but he found that the only position he felt most comfortable in was the semi-Fowler's position. If you're familiar with that, it's a approximate trunk recline of about 45 degrees. Technically, semi-Fowler's involves a little bit of flexion at the hips, but he was doing kind of a modified version of that. On his own, he had found that was the most comfortable position to be in. And I said, do you find that that position's the easiest to breathe in? And he says, yes, I do. So he had naturally assumed a position that puts you in the best mechanical advantage for breathing when you have problems associated with fluid overload. That's a significant sign clinically. So even though his heart rate, I should say his blood pressure was in normal range, his pulse oximetry was normal, his heart rate though was tachy at 117 beats per minute. He's complaining of shortness of breath. He continues to gain weight in fluid. He's now fluid distended in the abdomen. I'm sorry, but that's an acute situation. And this poor couple, they've been into the ER twice and they've been sent home twice without addressing this issue. Something needs to be done. And I told them, go to the hospital of your choice. And I said, I wanted to send him 911, but I understand their concern. He'll go to the closest hospital, which he doesn't want to go to. I said, how about right now you go to a hospital that you can actually choose before you get to the point where 911 is making the choice for you. And so they might follow through on that. I understand the reluctance because they've been kicked home twice now. So anyway, was my visit a billable service? I wanted to cover that also. Well, it's clear when I got there, based on his clinical findings, based on my knowledge of what's going on cardiovascularly with him, I did not prescribe any exercises. In fact, I adjusted his home exercise and said, don't do any home exercise right now. Until you get this taken care of, nothing. Just get to the bathroom. That's about it. And otherwise, don't do any other activities until you get this problem resolved, because clearly he's not medically stable. He's in fluid overload, and despite being young, even though he doesn't have the official diagnosis of CHF, it's clear the cardiac demand on this guy is ridiculously high. And so anyway, I just thought I'd bring up that interesting scenario because now 2 patients have been very clinically complex and a significant visit that made me evaluate and adjust how I approach their care, which of course is a skill. If you have to adjust how you're doing things, that's not something a non-licensed person has the knowledge and expertise to safely and effectively do. That's the kind of stuff that we should be demonstrating to prove that we needed to be there, thus making this a billable visit for home health. Anyway, just sharing. Take care. God bless.